Case Report 7.2. An emergency medical technician EMT working in the Fullwood Medical Center Emergency Department. Janice Tierney, a 17-year-old high school student who presents with fainting at school. She is pale, her pulse is 90, and her blood pressure is 100 over 60. She tells you that she is having a menstrual period with excessive bleeding. Her physical examination is otherwise unremarkable. She has a past history of easy bruising and recurring nosebleeds, and an episode of severe bleeding after a tooth extraction. Janice has a deficiency of von Willebrand factor. Her platelets are unable to stick together, and a platelet plug cannot form in the lining of her uterus to help her in her menstrual flow. Disorders of white blood cells. Infectious mononucleosis occurs in the 15 to 25-year-old population. It's because the Epstein-Barr virus, EPV, is a very common virus and a member of the herpes family. The EPV is transmitted by an exchange of saliva, such as a kiss. Leukemia is a cancer of the blood-forming tissues and produces a high number of leukocytes and their precursors. The leukemic cells multiply, taking over the bone marrow and causing a deficiency of normal red blood cells, white blood cells, and platelets. This makes the patient anemic and vulnerable to infection and bleeding. In leukopenia, the WBC count drops below 5,000 cells per cubic millimeter of blood. Leukopenia is seen in viral infections like measles, mumps, chickenpox, poliomyelitis, and AIDS. In pancytopenia, the erythrocytes, the red blood cells, leukocytes, white blood cells, and thrombocytes, platelets, in the circulating blood are all noticeably reduced. This can occur with cancer chemotherapy. Hemostasis. Hemostasis is the control of bleeding. It is a vital issue in maintaining homeostasis, the state of the body's equilibrium. Uncontrolled bleeding can offset the body's balance by decreasing blood volume and lowering blood pressure. Platelets, also called thrombocytes, play a key role in hemostasis. They are minute fragments of large bone marrow cells and consist of a small amount of granular cytoplasm surrounded by plasma membrane. They have no nucleus. Hemostasis is achieved through a three-step process. Vascular spasm, an immediate but temporary constriction of the injured blood vessels. Platelet plug formation, an accumulation of platelets that bind themselves together and adhere to surrounding tissues. The binding and adhesion of platelets are mediated through von Willebrand factor, a protein produced by the cell's lining of the blood vessels. Blood coagulation is the process of going through prothrombin and thrombin to the formation of a blood clot that traps blood cells, platelets, and tissue fluid in a network of fibrin. After a blood clot forms, platelets adhere to strands of fibrin and contract to pull the fiber and the edges of the broken blood vessels together. Fibroblasts invade the clot to produce a fibrous connective tissue that seals the blood vessel. Disorders of coagulation, coagulopathies. There are several disorders that can prevent the blood from clotting properly, and these can lead to further health problems. Hemophilia. In its classical form, hemophilia A is a disease male inherited from their mothers. It results from a deficiency of the coagulation factor named factor the eighth. Von Willebrand disease is the most common hereditary bleeding disorder. Is a protein deficiency of the factor the eighth complex that is different from the factor deficiency involved in hemophilia. Case Report 7.3. You are an emergency medical technician, paramedic, EMTP, working in the Level 1 Trauma Unit at Fullwood Medical Center. You are communicating with Mrs. Joan Rohde, an an 18-year-old student who has been admitted to the unit from the operating room. Mrs. Rhodey has had surgery for multiple fractures sustained in a car accident. She is receiving a blood transfusion. You document that her temperature has risen to 102.8 degrees Fahrenheit. Her, her respirations have risen to 24 per minute, and she has chills. You take her blood pressure, and it has fallen to 90/60. What is your next step? Disorders of coagulation, coagulopathies, continue. Disseminated intravascular coagulation, DIC, occurs when a severe bacterial infection activates the clotting mechanism simultaneously throughout the cardiovascular system. Small clots form and obstruct blood flow into tissues and organs, particularly the kidney, leading to renal failure. Thrombus formation, thrombosis, is a clot that forms attached to a diseased or damaged area on the wall of a blood vessel or the heart. If part of the thrombus breaks loose, the moves through the circulation, it is called an embolus. Thrombocytopenia is a deficiency of platelets. Purpura is bleeding into the skin from small arterioles that produce larger individual lesions than the tiny red spots or petechiae from capillary bleeds. Bruises or hematomas are leaked of blood from all types of blood vessels. Idiopathic thrombocytic purpura, ITP. I'm going to repeat that one more time. Idiopathic thrombocytic purpura, ITP, occurs when the immune system destroys the body's platelets. An acute, self-limiting form of the disease occurs in children. A chronic form affects adults. Blood groups and transfusions. Red cells, antigens. Antigens are molecules that exist on the surface of red blood cells. Antigens are present in the plasma. Each antibody can combine with only a specific antigen. If the plasma antibodies combine with another red cell antigen, bridges form to connect these red cells together. This is called agglutination, or clumping of the cells. Hemolysis, destruction of the cells, also occurs. The antigen of the surfaces of the cell have been categorized in two groups. These two groups, the ABO and RH blood groups, are the most important. Going back to case report 7.3, in Joanne Rhodey's case, she has type A blood and by mistake received type AB blood, the red cells of which agglutinated in the presence of her antibodies. Your immediate response is to stop the transfusion, replace it with a saline infusion. Call your supervisor and notify the doctor. ABO blood groups. The two major antigens on the cell surface are antigen A and antigen B. A person with only antigen A has type A blood. A person with only antigen B has type B blood. A person with both antigen A and antigen B has type AB blood. A person with neither antigen has O blood and is universal donor and able to give blood to any other person. Specific antibodies are synthesized in the plasma during the first 8 months after birth. Whenever antigen A is absent, anti-A antibody is produced. Whenever antigen B is absent, anti-B antibody is produced. Figure 711 shows different combinations of antigens and antibodies in the different blood types. A transfusion of blood or packed red blood cells replaces the loss of red blood cells to restore the blood's oxygen carrying capacity. Autologous donations and transfusions occur when people donate their own blood ahead of time to be given back to them if necessary during a surgical procedure. RH blood group. If an Rh antigen is present on the red cell surface, the blood is said to be the Rh positive. This is common, and about 85% of the people are Rh positive. If there is no Rh antigen on the surface, the blood is Rh negative, which is the case for another 15% of the population. If an Rh negative person receives a transfusion of Rh positive blood, anti-Rh antibodies will be produced. This can cause RBC clumping, agglutination, and destruction, hemolysis. If an Rh negative woman and an Rh positive man conceive an Rh positive child, the placenta normally prevents maternal and fetal blood from mixing. However, at birth or during a miscarriage, fetal cells can enter the mother's bloodstreams. These Rh positive cells stimulate the mother's tissues to produce Rh antibodies. If the mother becomes pregnant with second Rh positive fetus, her Rh antibodies can cross the placenta and agglutinate and hemolyze the fetal red cells. This causes hemolytic disease of the newborn, HDN, or erythroblastosis fetalis. Hemolytic disease of the newborn due to Rh incompatibility can be prevented. The Rh negative mother giving birth to an Rh positive child should be given Rh immune globin, ROGAM. Other causes of hemolytic disease in newborns includes ABO incompatibility, incompatibility in other blood group systems, hereditary spherocytosis, and infections acquired before birth. Continued. The patient's medical and family history and physical examination are most important tools in diagnosing blood disorders. A complete blood count gives important information about the types and numbers of cells in the blood, enabling diagnosis of the cause of such symptoms as weakness, fatigue, and bruising. Included in the CBC is the number of red blood cells. If the count is low, anemia could be present, and if the count is high, polycythemia can be diagnosed. If the total amount of hemoglobin in the blood and the hematocrit are both low in the CBC, anemia is present. A red blood cell index, the means corpuscular volume, MCV, shows the average size of red blood cells. If the cells are small, microcytic, the most common cause is an iron deficiency anemia. If the cells are large, macrocytic, a possible cause is pernicious anemia. A white blood cell count is usually included in a CBC along with the numbers and types of different white blood cells. A white blood cell differential. These tests give the pathologists and clinicians who read the test critical information about the body's response to infection, toxic medicines, chemicals, and allergens, and show many other conditions such as leukemia. Also included in a CBC is the number of platelets. A low platelet count can indicate idiopathic thrombocytopenic purpura (ITP). There are more than a dozen coagulopathies, bleeding disorders, and the diagnostic procedures to determine the cause of a patient's abnormal bleeding include the CBC, a bleeding time, prothrombin time, PT, and partial thromboplastin time, PTT, which help define where deficiencies might lie in the clotting process. The combination of all these tests is called coagulation panel. Other diagnostic procedures for blood disorders include a blood smear, in which a drop of blood is smeared on a slide, stained, and examined under a microscope to determine the size and shape of RBCs, WBCs, and platelets. A bone marrow aspiration, biopsy, is a procedure used to define the production of the different blood cells. In disorders of the lymphatic system, the essential diagnostic procedure is biopsy of an enlarged lymph node. This can be followed by X-rays, CT scans, and MRI scans to determine the spread of a disease such as lymphoma. Therapeutic procedures for blood disorders. In anemia, treatment consists of replacing any deficiency in the production of hemoglobin, such as iron or vitamin B12. For hemolytic and aplastic anemias, the treatment is to define and remove the toxin, drugs, or radiation source that is causing the destruction of or inability of the bone marrow to produce red cells. A bone marrow transplant is a transfer of bone marrow from a healthy, compatible donor to a patient with aplastic anemia, leukemia, lymphoma, or other disease. Several drugs affect blood clotting. Aspirin is given in small 81 milligram doses to reduce platelets adherence and agglutination. Heparin, given parenterally, acts quickly to prevent prothrombin and fibrin inflammation. Warfarin, Coumadin, given orally, also acts to prevent prothrombin and fibrin inflammation, and its effect is monitored by PT blood tests. Dabigatran, Xylate, Pradaxa, and other similar compounds are given orally as anticoagulants in cases of non-valvular auricular fibrillation. To prevent blood clots from forming and embolizing, streptokinase dissolves the fibrin in blood clots, and if given intravenously within 3 to 4 hours of a heart attack, it is often effective in dissolving the clots that has caused the heart attack. Tissue plasminogen activator, TPA, binds to fibrin and also dissolves clots that have caused heart attacks.